Hi, I'm Medicare Mike. Shopping for Medicare can be confusing and complicated, but it doesn't have to be. I've created this quick presentation to cover the A's, B's, C's, and D's of Medicare and make your experience a little bit easier. If you have questions after watching the video, feel free to give us a call and we'd be happy to be of value and service to you. Hi everyone, and thanks for being here. I'm glad you're taking the time to learn about Medicare because for most people, this is something they're expected to figure out with very little guidance. This is Medicare 101 presented by the Medicare Mike team. Whether you're turning 65, already on Medicare, or helping a spouse or family member, my goal today is simple: to explain Medicare in a way that actually makes sense. There's no sales pitch here. We're just going to walk through how Medicare works, what your options are, and what people should really be thinking about when they're making decisions. My name is Michael Serino, but most people know me as Medicare Mike. I'm the founder of the Medicare Mike team, an independent Medicare brokerage based in Arizona. We work with clients in Casa Grande, Phoenix, and all over the country. At the Medicare Mike team, everything we do starts with education. We specialize in Medicare Supplement planning, but we also help people understand Medicare Advantage plans and Part D prescription drug plans. Because we're independent, we're not tied to any one insurance company. That means our job isn't to push a specific plan. Our job is to help you understand your options so you can decide what actually fits your situation. Before we go any further, I need to share a quick disclaimer. The Medicare Mike team is not affiliated with the U.S. government or the federal Medicare program. We don't offer every plan available in your area, and today's presentation is for educational purposes only. For official Medicare information, you can always visit medicare.gov or call 1-800-MEDICARE. Let's start with the basics. Medicare is the federal health insurance program for people age 65 and older, as well as some individuals under age 65 with qualifying disabilities. One thing I always like to clear up early is what Medicare is not. Medicare is not Medicaid, which is an income-based coverage. It is not Social Security, which is retirement and disability income program. And it's not family coverage. Each person enrolls in Medicare individually, even if you're married. That distinction alone clears up a lot of confusion. Most people become eligible for Medicare when they turn 65, even if they're still working or already have insurance through an employer. Some people qualify earlier because of a disability or end-stage renal disease. One of the most common questions we hear is, just because I can enroll, does that mean I should? And the answer is, not always. Eligibility and timing are two different things, and understanding that can save you a lot of headaches later. Original Medicare is made up of two parts, Part A and Part B. Think of these as the foundation of your Medicare coverage. They give you access to doctors and hospitals nationwide that accept Medicare, but they don't cover everything, and they don't limit your out-of-pocket costs. Part A, hospital coverage. This is hospital insurance. It helps cover inpatient hospital stays, including your room, meals, nursing care, and inpatient medications. It also helps cover skilled nursing facility care after a qualifying hospital stay, hospice care, rehab services, and some home health care. A lot of people assume Part A is completely free. While it's often premium free if you or your spouse paid Medicare taxes for at least 10 years, there are still deductibles and cost sharing that can add up quickly if you're hospitalized. Part B is medical insurance. This is what covers things like doctor's visits, outpatient procedures, preventative care, lab work, durable medical equipment, ambulance services, and mental health care. Here's the part that most people don't realize at first. Medicare generally pays about 80% of Part B costs. You're responsible for the remaining 20%, and there is no annual maximum out-of-pocket. That's a big reason why most people eventually add additional coverage. Original Medicare includes deductibles and coinsurance, and for some people, higher income can also mean higher premiums. This is where IRMA comes into play. IRMA stands for Income-Related Monthly Adjusted Amount. It applies to Medicare Part B and Medicare Part D. IRMA is based on your income from 2 years ago, not what you're earning today. These amounts are reviewed every year and can change. Just to be clear, IRMA is set by Medicare, not by insurance companies or brokers. If you are subject to an IRMA penalty, you can also appeal it with a qualifying life event, like retirement or a reduction in work. We are happy to assist with these appeals should you need to file one. Original Medicare doesn't cover prescription drugs, routine dental care, routine vision care, hearing exams or hearing aids, long-term care, or most care outside of the United States. This is where people often get caught off guard, and it's why almost everyone we work with adds some form of additional coverage. When it comes to filling in those gaps, there are two main paths that people take. The first option is Original Medicare combined with a Medicare Supplement, also called a Medigap plan, along with a separate Part D prescription drug plan. This option is popular with people who want predictable costs and the freedom to see doctors nationwide without worrying about networks. The second option is Medicare Advantage. These plans bundle coverage together and may include extra benefits like dental or vision, but they also include provider networks, copays, and an annual maximum out-of-pocket. Medicare Supplement plans help cover the out-of-pocket costs left by Original Medicare. These plans are standardized by the federal government, which means the benefits are the same regardless of which insurance company offers the plan. They're guaranteed renewable, accepted nationwide, and don't require referrals. At the Medicare Mike team, Plan G is the most common option we review for people new to Medicare because it offers strong, predictable coverage. On average, Medicare Supplement plans cost about $200 per month. However, that can vary by policy, issue age, and location. Medicare Advantage plans are offered by private insurance companies approved by Medicare. They combine Part A and Part B and usually include prescription drug coverage. They often include additional benefits, but they also come with networks, copays, and an annual out-of-pocket maximum that resets each year. On average, you can expect Medicare Advantage plans to have no premium, but far more limitations than a Medicare Supplement plan. It is imperative with Medicare Advantage plans to verify all your doctors are accepted by the plan you choose, or you could lose access to your doctor. Medicare Part D helps cover prescription drug costs. Each plan has its own drug list, called a formulary, and medications are placed into pricing tiers. Because drug lists and pharmacies change, reviewing Part D coverage every year is important. This is something we help clients with regularly at the Medicare Mike team. There are 3 stages to prescription drug coverage: deductible, initial coverage, and catastrophic coverage stage. Most important to note here is that after deductible, you will largely pay copays determined by the tier or class of drug that you take. These copays cannot exceed the maximum out of pocket, which is $2,100 in 2026. This is a standard amount set by Medicare and is the same for all drug plans that are offered. It is crucial to evaluate all of your prescription drug needs with your broker and ask them to make sure to tell you where all of your drugs are tiered. In addition to the Part B IRMA, it is important to note that Medicare Part D is also subject to a separate additional penalty as well. This would be in addition to any premium paid for a Medicare prescription drug plan. Medicare enrollment timing matters. Missing certain enrollment periods can lead to penalties that last for life. Helping people understand these timelines and avoid costly mistakes is one of the most valuable things that we do. There's no one-size-fits-all Medicare plan. The right choice depends on your health, your budget, how often you use healthcare, and how comfortable you are with risk. Our role at the Medicare Mike team is to provide education first, answer your questions, and help you feel confident in your decisions. Thank you again for taking the time to learn about Medicare. If you have questions or would like help reviewing your options, our contact information is on the screen. We're always happy to help, no pressure, just guidance. Thanks for watching. We hope this video was educational and informative and you have a better understanding of your Medicare options. If you still have questions, please feel free to reach out to us. We would love to be of value and service to you.